ہینا پرکار انڈین مسلم ایسوسی ایشن لیڈیز ونگ کی طرف سے آپ سب کا ہمارے اس سیشن میں تہہ دل سے استقبال کرتی ہوں۔ A wise person once said, "To keep the body in good health is an expression of gratitude and a means to attain a well-balanced life." Therefore, with an objective to achieve community development and social welfare, IMA LadiesWing and the Indian Doctors Forum has come together today for this cancer awareness session. IMA Kuwait strives to promote Islamic knowledge among Indian expats and is a registered association with the Indian Embassy in Kuwait. The IDF, headed by President Diwakar and Community Secretary Dr. Syed Mahmood, are those responsible for facilitating this webinar. Now we shall begin the program with the recitation of the Holy Quran. I would like to invite Sister Hajra Syed to recite verses 75 to 85 from Surah Ash-Shura. Sister Hajra.
السلام علیکم ورحمۃ اللہ وبرکاتہ۔ اعوذ باللہ من الشیطان الرجیم، بسم اللہ الرحمن الرحیم۔ قال افرأیتم ما کنتم تعبدون انتم وآباؤکم الاقدمون فإنهم عدو لي إلا رب العالمين الذي خلقني فهو يهدين والذي هو يطعمني ويسقين وإذا مرضت فهو يشفين والذي يميتني ثم يحيين والذي أطمع أن يغفر لي خطيئتي يوم الدين رب هب لي حكما وألحقني بالصالحين واجعل لي لسان صدق في الآخرين واجعلني من ورثة ترجمہ، آپ نے فرمایا کچھ خبر بھی ہے جنہیں تم پوچھ رہے ہو؟ تم اور تمہارے اگلے باپ دادا وہ سب میرے دشمن ہیں بجز سچے اللہ تعالیٰ کے جو تمام جہان کا پالن ہار ہے، جس نے مجھے پیدا کیا اور وہی میری رہبری فرماتا ہے، وہی ہے جو مجھے کھلاتا ہے اور جب میں بیمار پڑ جاؤں تو مجھے شفا عطا فرماتا ہے، اور وہی مجھے مار ڈالے گا پھر زندہ کر دے گا، اور جس سے امید بندھی ہوئی ہے کہ وہ روز جزا میں میرے گناہوں کو بخش دے گا۔ اے میرے رب، مجھے حکمت عطا فرما اور مجھے نیک لوگوں میں ملا دے، اور میرا ذکر خیر پچھلے لوگوں میں بھی باقی رکھ، اور مجھے نعمتوں والی جنتوں کے وارثوں میں بنا دے۔ آمین و اجمعین۔ جزاکم اللہ خیرا کثیرا۔
Jazakallah khair, sister. Now proceeding with the program, I would like to invite our very own Fahil Unit Coordinator and CSC member. She has completed her graduation in engineering and is also a tafsir teacher with IMA. I would like to invite Sister Nazia Umar to share with us few words on the topic Health, a Hidden Crown. Sister Nazia Umar.
جزاک اللہ خیر۔ بسم اللہ، الحمد للہ، الصلاۃ والسلام علی رسول اللہ، رب اشرح لی صدری ویسر لی امری واحلل عقدۃ من لسانی یفقہوا قولی۔ اللہم الہمنا رشدنا واعذنا من شرور انفسنا، آمین یا رب العالمین۔ السلام علیکم ورحمۃ اللہ وبرکاتہ۔ قال عن ابن عباس رضی اللہ عنہ قال قال رسول اللہ صلی اللہ علیہ وسلم نعمتان مغبون فیہما کثیر من الناس الصحۃ والفراغ، رواہ بخاری۔ عزیز سامعات، ابھی میں نے آپ کے سامنے صحیح بخاری کی ایک حدیث پڑھی جس کا ترجمہ ہے، جس کا میننگ ہے ابن عباس رضی اللہ عنہ کہتے ہیں کہ نبی اکرم صلی اللہ علیہ وسلم نے فرمایا 2 نعمتیں ایسی ہے جس کے بارے میں اکثر لوگ دھوکا کھا جاتے ہیں، وہ ہے صحت اور فراغت، یعنی خالی وقت۔ ہم سبھی جانتے ہیں کہ صحت جو ہے اللہ تعالیٰ کی طرف سے دی ہوئی بڑی بڑی نعمتوں میں کی ایک عظیم نعمت ہے۔ اللہ تعالیٰ سورہ نحل میں فرماتے ہیں اگر تم میری نعمتوں کا شمار کرنا چاہو تو نہیں کر سکتے۔ کہا جاتا ہے کہ صحت وہ تاج ہے جسے صرف بیمار دیکھ سکتے ہیں، وہ اس لیے کیونکہ ان کی جب وہ بیمار ہوتے ہیں اور وہ دوسروں کو دیکھتے ہیں اس وقت ان کو محسوس ہوتا ہے کہ ہم کتنی اچھی حالت میں تھے، ہم کتنے اچھے تھے اس سے پہلے، اور اب ہم بیمار ہو گئے تو ہم کتنی ساری پریشانیوں کے ساتھ ہیں۔ اسی لیے اس عظیم نعمت کو، اتنی بڑی نعمت کو جو اللہ تعالیٰ نے ہم کو عطا کی ہے، ہم نے اس کی قدر بھی کرنا چاہیے، ہم نے اس کی حفاظت بھی کرنا چاہیے، اور خاص طور پر عبادت جس کے لیے اللہ تعالیٰ نے ہم کو پیدا کیا، ہم نے اس کی تکمیل کے لیے صحت مند رہنا ضروری ہے۔ کیا آپ نے کبھی اپنی باڈی کے بارے میں یا اپنی صحت کے بارے میں کبھی وقت لگایا اور کبھی سوچا؟ کچھ وقت اپنے ساتھ بتاتے ہوئے آپ نے اپنے جسم کے اوپر کبھی غور و فکر کیا کہ آپ کتنی ساری نعمتوں کے ساتھ، آپ بلینئر ٹریلینئر، پتہ نہیں کتنی ساری نعمتیں ہمارے جسم میں اللہ تعالیٰ نے ہم کو دی ہے، اور ہم کتنے خوش قسمت ہیں کہ ہمارا جسم بہت اچھا ہے۔ اور کیا کبھی اس انسان کے بارے میں آپ نے سوچا کہ جنہوں نے جیسے جو عام رواج آج کل چل پڑا ہے کہ نماز جب ہم پڑھتے ہیں تو چیئر پر بیٹھ کر پڑھتے ہیں، تو کیا انہوں نے اپنی آخری نماز ان کو یاد ہوگی جب انہوں نے زمین پر سجدہ کیا ہوگا؟ کیا آپ کو لگتا ہے کہ وہ وقت ان کو پتا تھا کہ اب اگلی بار سے میں زمین پر سجدہ نہیں کر پاؤں گی؟ کہنے کا مطلب یہ ہے کہ جب ہمیں یہ پتا نہیں ہوتا کہ ہماری یہ انمول نعمت ہم سے کب دور ہو جائے گی۔ اور چلے عمر کے ساتھ ساتھ جن لوگوں کو پریشانیاں جسم کے اعضاء میں ہوتی ہے ان کے لیے تو وہ ایک اناوائڈیبل چیز ہے، لیکن آج کل تو ہم دیکھتے ہیں کہ ینگ لوگ بھی جوڑوں میں درد، گھٹنوں میں درد، پیروں میں درد کی وجہ سے یا بیک میں تکلیف کی وجہ سے زمین پر سجدہ نہیں کر سکتے۔ وہ سجدہ جو ہماری پہچان ہے، جہاں پر سر ٹکا کر ہم یہ یاد دلاتے ہیں اپنے آپ کو کہ میری یہ جگہ ہے اور میرا رب سب سے اعلیٰ ہے، ہم کتنی بڑی نعمت سے محروم ہو رہے ہیں۔ چلے ایک نظر یہ بھی دیکھتے ہیں کہ یہ صحت ہمارے لیے نعمت کیسے ہے۔ سوچے ایک لقمہ، ایک بائٹ جب ہم منہ میں ڈالتے ہیں تو منہ میں وہ جانے سے لے کر ہضم ہونے تک ہماری باڈی کتنے سارے ارینجمنٹس کرتی ہے اس کے لیے۔ اگر ٹھنڈا ہے کھانا یا گرم ہے یہ ہمیں ہاتھ بتا دیتا ہے، تازہ ہے یا باسی ہے یہ ہمیں ناک بتا دیتی ہے، کڑوا ہے تیکھا ہے یہ ہمیں زبان بتا دیتی ہے، سخت ہے تو دانت بتا دے گا۔ اگر پھر بھی کوئی سخت چیز کوئی ہمارے اندر چلی گئی تو ہمارے ایسوفیگس میں، ہمارے پیٹ میں کچھ ایسڈز ہوتے ہیں، وہ اس کو پوری طرح سے ڈیزولو کر دیں گے، گلا دیں گے، اور پھر باڈی سے اس کو نکال دیا جائے گا۔ سوچے ذرا، اگر آپ رات میں سکون کی، اطمینان کی نیند سو سکتے ہیں، یعنی آپ بہت خوش قسمت ہے، کیونکہ جو انسومنیا ہوتا ہے، نیند نہ آنے کی بیماری، یہ زیادہ سے زیادہ دوائیاں لینے کے باوجود انسان اس سے نکل نہیں سکتا، الٹا اس کی صحت کو اور نقصان ہی پہنچاتی ہے۔ اگر ہم یہ بھی سوچیں، ہم یہ اتنی باریک چیز ہے کہ اگر ہم اپنی آئی لیشز، اپنی پلکیں، ہم نارملی اگر اس کو فلپ کر پا رہے ہیں، ہم اپنی پلکیں جھپکا سکتے ہیں، تو یہ بھی بڑی نعمت ہے، کیونکہ آج کے زمانے میں کئی ایسے ملینئرز ہیں جو کچھ ایسے ملینئرز ہیں جو اس بیماری میں مبتلا ہے کہ وہ یہ ان کے جو آئی لیشز کے مسلز ہیں وہ ان کا ساتھ نہیں دے رہے، اور وہ آسانی سے اپنی پلکیں نہیں جھپکا سکتے۔ ہم کبھی ان چیزوں کے بارے میں سوچتے نہیں ہیں۔ ہمارے کانوں میں ایک لیکوڈ ہوتا ہے جس کی وجہ سے ہماری باڈی جو ہے وہ بیلنس رہتی ہے، ہم نے تو کبھی اس کے بارے میں دھیان ہی نہیں دیا کہ ہماری باڈی کیسے بیلنس، ہم کیسے یہ کر پا رہے ہیں۔ جن لوگوں کو یہ مرض ہوگا کہ سر گھومتا رہتا ہے یا پھر چکر آتے ہیں، تو وہ اس بات کو سمجھ سکتے ہیں کہ یہ اس طرح سے زندگی گزارنا کتنا تکلیف دہ ہوتا ہے۔ تو سوچیں ہم صحت مند ہیں، یعنی ہم کتنے خوش قسمت ہیں۔ اب ان نعمتوں کی قدر کریں، ہم نے ان نعمتوں کی قدر کرنی چاہیے۔ نبی اکرم صلی اللہ علیہ وسلم نے فرمایا کہ اللہ تعالیٰ کے نزدیک طاقتور مومن کمزور مومن سے بہتر ہے، ہاں جبکہ دونوں میں بھی اچھائی ہے۔ یہ صحیح بخاری کی حدیث ہے۔ امام ابن تیمیہ اس کے بارے میں کہتے ہیں کہ یہاں اس حدیث میں یقیناً جسمانی صحت کی، فزیکل باڈی کی بات ہو رہی ہے، کہ جس کو طاقتور بتایا گیا، اور ایسے لوگوں کو جو فزیکلی اسٹرانگ ہے اللہ تعالیٰ ان کو پسند کرتا ہے۔ تو ایک قوی مومن جو ہے، ایک طاقتور انسان، بے شک اچھے انداز میں اللہ اپنے فرائض کو انجام دے گا، اللہ تعالیٰ کی عبادت کرے گا، اس کی جتنی بندگی رب کے تقاضے ہیں ان کو پورا کرے گا۔ اس کے علاوہ ہمیں یہ بھی بتایا گیا کہ نبی اکرم صلی اللہ علیہ وسلم نے فرمایا تم اپنے بچوں کو سوئمنگ سکھاؤ، تیر اندازی یعنی تیر چلانا سکھاؤ، گھڑ سواری سکھاؤ۔ یہ حدیث کیا بتاتی ہے کہ جسمانی صحت، تندرستی، چاقو چوبند رہنا، الرٹ رہنا، یہ وہ کوالٹیز ہیں جو ایک مومن کے اندر اسلام دیکھنا چاہتا ہے۔ ٹھیک ہے، آج کے زمانے میں ہم دیکھتے ہیں کہ فاسٹ فوڈ ہے، پیکیج فوڈ ہے، پروسیس فوڈ ہے، ہم اس کے اتنے عادی ہو چکے ہیں کہ ان سے ہونے والے نقصانات کے معلوم ہونے کے باوجود ہم ان کو چھوڑ نہیں پا رہے، اور کبھی خدا نخواستہ جب ان کی وجہ سے کینسر، شوگر، سکن ڈیزیز، اوبیسٹی، استھما ایسی جو بیماریاں انسان کے اندر پیدا ہو جاتی ہے، تب جا کے وہ اپنی علاج کی طرف منہ موڑتا ہے۔ لیکن اس وقت بھی انسان صرف دوائیوں پر ڈیپینڈ ہو جاتا، اس ریزن کو ڈھونڈنے کی یا پہچاننے کی کوشش نہیں کرتا کہ میں بیمار پڑا کیوں، کیا میری لائف سٹائل اس کے لائق نہیں تھی کہ جس وجہ سے میں بیمار ہو گیا۔ تو اس کا نہ انسان کے پاس آج کے زمانے میں وقت ہے، نہ اس کو اتنی فکر ہی ہے۔ اس کے برعکس اسلام جو ہے ہمیں اپنی تعلیمات کے بارے میں، اپنی تعلیمات میں بار بار صحت کی طرف توجہ دلاتا ہے۔ رسول اکرم صلی اللہ علیہ وسلم کا ارشاد ہے کہ تم پر تمہارے جسم کا حق ہے، your body have right on you۔ اور قرآن میں اللہ تعالیٰ نے ہم کو دعا سکھائی، ربنا آتنا فی الدنیا حسنہ وفی الآخرۃ حسنہ وقنا عذاب النار۔ اے ہمارے رب ہم کو دنیا میں بھی بھلائیاں دے، یعنی ہمیں صرف یہ نہیں کہا گیا کہ صرف تم نے ورشپ ہی کرنا ہے اور یہی تمام چیزیں، بلکہ اپنی باڈی کا، اپنی دنیا کی چیزوں کو تم کو انجوائے کرنے کے لیے تم اچھائیاں مانگو۔ صحت خراب کرنے والی، جو صحت خراب جس وجہ سے ہوتی ہے اس کی ایک بنیادی وجہ ہے، بیسک جو ریزن ہوتا ہے وہ گندگی ہے، رائٹ؟ اور اسلام نے بہت اسٹرکٹلی اس کے بارے میں ہم کو انسٹرکشن دیے گئے ہیں کہ گندگی کو ختم کیا جائے اور صفائی اور پاکی کو حاصل کیا جائے۔ قرآن میں اللہ تعالیٰ نے بالکل شروعات میں جب پروفیٹ محمد صلی اللہ علیہ وسلم پر ریویلیشن سٹارٹ ہوئے، سورہ مدثر میں اللہ تعالیٰ کہتے ہیں وَثِيَابَكَ فَطَهِّرْ، اپنے کپڑوں کو پاک رکھو۔ نبی اکرم صلی اللہ علیہ وسلم نے کہا کہ پاکی آدھا ایمان ہے، پاکی کو ایمان سے جوڑ دیا گیا۔ تو سوچیں کہ ہم نے پاک صاف رہنے کو کتنی پرائرٹی دینا ہے۔ ہمیں اسلام جو ہے اس صحت کی حفاظت کے لیے بہت زیادہ مطلب موٹیویٹ کیا جاتا ہے، خاص طور پر اس میں ہم نے لاپرواہی نہیں برتنی ہے، اور اس سے بڑھ کر ہم نے ایسی چیزیں کرنی چاہیے جس کی وجہ سے، یعنی پریکاشن از بیٹر دین کیور، رائٹ؟ تو صحت کی طرف سے ہم نے بہت احتیاط کے ساتھ احتیاط رکھنے ہیں، اور ہمیں جو چیزیں اسلام سکھاتا ہے، جیسے ہم جب صبح اٹھ رہے ہیں تبھی سے لے کر ہمیں بتایا گیا کہ اٹھنے کے ساتھ ہم نے پہلے ہاتھ دھونا ہے، اپنے ہاتھ دھونا ہے، کیونکہ رات میں پتہ نہیں ہاتھ ہمارا کہاں استعمال ہوا۔ اس کے علاوہ پھر ناک صاف کرنے کی انسٹرکشن دی گئی۔ کیوں؟ اب ہم دیکھیں جن لوگوں کو سائنس یا ناک کی جو بیماریاں ہوتی ہے ان کے لیے خاص طور پر اگر یہ پروسیس وہ ڈیلی کرتے ہیں تو ڈاکٹرز بھی اس کو سجیسٹ کرتے ہیں اس کی وجہ سے، اور کچھ لوگوں کا پریکٹیکل یہ رہا کہ اس ایکسپیرینس رہا کہ اس کی وجہ سے ان کا سائنس اور ناک کی بیماریاں دور ہوئی۔ ٹھیک ہے، وضو جب ہم کرتے ہیں تو ہمارے جو جتنے بھی باہر کے اعضاء ہیں ان سب کو ہم صاف کرتے ہیں، ناک میں پانی چڑھانا اس کا ایک ضروری حصہ ہے، ٹھیک ہے، وضو کے حساب سے۔ پھر اس کے ساتھ ساتھ ہمیں جب کھانا کھاتے ہیں تو ہمیں سیدھے ہاتھ سے اور ہاتھ دھو کر کھانا کھانے کے لیے کہا گیا، بسم اللہ پڑھنے کے لیے کہا گیا۔ اورل ہیلتھ، نبی اکرم صلی اللہ علیہ وسلم کو مسواک کتنا پسند تھا، آپ صلی اللہ علیہ وسلم ہر نماز کے پہلے اپنے دانتوں کو صاف کیا کرتے۔ آج دیکھیں کتنی بڑی لائن ہوتی ہے ڈینٹسٹ کے پاس میں، اور کتنی تکلیف دہ چیز ہے، مطلب دن رات کا سکون چھن جاتا ہے جب ہمارے دانتوں میں تکلیف ہوتی ہے، رائٹ؟ تو اورل ہیلتھ کا خیال رکھنے کے لیے ہم کو تاکید کی گئی۔ پھر اس کے ساتھ کم کھانا، آپ صلی اللہ علیہ وسلم نے فرمایا کہ مومن ایک آدھ کھاتا ہے، 1/3 ہم نے کھانا چاہیے، ایک حصہ جو ہے ہوا کے لیے اور ایک حصہ پانی کے لیے چھوڑنا چاہیے۔ ہم لیڈیز خاص طور پر جب پانی مطلب گھر میں کیونکہ ہماری کوئی ایسی ایگزرشن نہیں ہوتا، اسی لیے ہم کم سے کم پانی پیتے ہیں، اس کے اوپر زور دیا گیا۔ آپ صلی اللہ علیہ وسلم نے فرمایا کہ پانی پینا چاہیے، انفیکٹ صاف ستھرا پانی پیے، پانی کو دیکھ کر پیے اور بیٹھ کر پیے، ٹھیک ہے، اور تیزی سے نہ پیا جائے، یعنی ناٹ گلپنگ، بلکہ آرام سے اطمینان سے 3 سپس لے کر پیا جائے، اس سے بھی ہماری صحت کے اوپر بہت اثر پڑتا ہے، ٹھیک ہے۔ اس کے علاوہ پھر نبی اکرم صلی اللہ علیہ وسلم نے فرمایا کہ اپنے مطلب کپڑوں کو پاک صاف رکھنے کی پہلے بات ہوئی، اچھا یہاں صرف یہ نہیں کہ انسان کے صرف اپنے ہی اوپر زور دیا جا رہا کہ تم پاک صاف رہو باقی سوسائٹی کے ساتھ کچھ بھی ہو، ایسی بات نہیں. ہمیں یہ بھی انسٹرکشنز دیے گئے کہ سوسائٹی میں تم جہاں رہتے ہو آپ کی سوشل لائف کے اندر بھی لوگوں کو آپ کی وجہ سے یا آپ کی کسی گندگی کی وجہ سے لوگوں کو تکلیف نہ پہنچے. تو آپ صلی اللہ علیہ وسلم نے یہ بھی فرمایا قرض کیا ایسے لوگوں کو جو انسان اگر روڈ سائڈ پر گندگی کرتا ہے، اسپیشلی اگر وہ مطلب اپنا سٹول پاس کرے یا ایسی گندگیاں کرے. اور اس کے علاوہ آپ صلی اللہ علیہ وسلم نے یہ بھی فرمایا کہ ٹھہرے ہوئے پانی کے اندر یورینیٹ نہ کیا جائے، کیونکہ یہ بالکل بھی صحت کے خلاف ہے، یہ ایک گندی چیز ہے اور اس سے دوسروں کو بھی نقصان پہنچے گا. تو اور سب سے اہم بات ہمیں بتایا گیا کہ راستے سے تکلیف دہ چیز کو ہٹانا یہ چیریٹی ہے. تو سوچیں جب ہمیں یہ سکھایا جا رہا ہے کہ خراب چیزوں یا تکلیف دینے والی چیزوں کو ہٹائیں، تو ہم اپنی سوسائٹی کے اندر گندگی یا کچرا یا پھر جس کے اوڈر بھی آ رہی ہے، جس سے خرابیاں بیماریاں بھی پھیل رہی ہیں، ہم ایسی چیزوں کو فروغ نہیں دے سکتے. ہم نے اس کا احتیاط کرنا چاہیے. اچھا اب ہم ایک آخری حصہ جو ہے اس بات کا وہ یہ ہے کہ ہم جب یہ دیکھتے ہیں کہ اچھا ہمیں پریکاشن بھی کرنا ہے، ہم نے تو صحت مند ہی رہنا ہے، تو پھر اب بیماری آئے تو کیا؟ ایسا تو نہیں ہے کہ بندہ بیمار ہی نہیں ہوگا. تو اگر بیماری آئے تو ہمارے لیے، جیسے ابھی آپ نے تلاوت کے اندر سنا، حضرت ابراہیم علیہ السلام کی زبانی اللہ تعالیٰ نے قرآن کے اندر یہ بتایا کہ وہ کہتے ہیں کہ جب میں بیمار ہوتا ہوں تو اللہ ہی مجھے شفا دیتا ہے. یعنی being sick اور not feeling well is not bad. اوکے طبیعت خراب ہوتی ہے، بیمار ہوتا ہے انسان، ہاں اس میں ہم یہ دیکھیں کہ اس بیماری کے اندر میرا کتنا حصہ ہے، میری لائف سٹائل کی وجہ سے یہ خرابیاں آئی یا پھر ایک نیچرل چیز تھی. اینی وے دونوں میں سے کوئی بھی بات ہو، لیکن اس صورت میں ہمارا طریقہ یہ ہونا چاہیے we have to be patient. ہم نے دعا کرنی ہے، ساتھ ساتھ میں ہم نے امید رکھنی کہ اللہ تعالیٰ مجھے شفا دے دے گا. ٹھیک ہے، اللہ تعالیٰ ہی شفا دے سکتا ہے. نبی اکرم صلی اللہ علیہ وسلم نے، یہ مسلم کی حدیث ہے، آپ نے فرمایا کہ ہر بیماری کی دوا ہے. جب دوا بیماری کو لگ جاتی ہے تو مریض اللہ کے حکم سے شفا یاب ہو جاتا ہے، مطلب ہی گیٹس کیور. جب بیماری اور دوا ایک ساتھ اگر مل جائے، صحیح دوا اگر لگ گئی تو بیماری دور ہو جاتی ہے. نبی اکرم صلی اللہ علیہ وسلم نے یہ بھی فرمایا کہ ہر بیماری جو زمین پہ اتری اس سے پہلے اللہ تعالیٰ نے اس کا کیور بھیج دیا. تو اور ایک حدیث میں آتا ہے کہ صرف ایک بیماری ہے جس کا کیور نہیں ہے. صحابہ کرام نے پوچھا کہ وہ کیا؟ تو کہا کہ وہ بڑھاپا ہے. تو بڑھاپے کی کوئی علاج نہیں ملے گا بے شک، مطلب نو ون کین بی ایور ینگ. ہاں ایور ینگ لائک انرجیٹک رہ سکتے ہیں، صحت مند رہ سکتے ہیں، لیکن بڑھاپا اپنے ساتھ کچھ نہ کچھ جو چیزیں لے کر آتا ہے وہ تو ہوتی ہے. تو خیر اب ہم بس کچھ چیزیں دیکھتے ہیں کہ ہم کیسے یہ پریکاشنز کو اپنی پریکٹیکل لائف میں ہم کیا کیا چیزیں کریں جس کی وجہ سے ہمیں بیماریوں کا سامنا نہ کرنا پڑے، یعنی ہم صحت مند کیسے رہ سکتے ہیں. سب سے پہلے یہ چیز ہے کہ ہم بیماری کو بیمار مطلب ہونے سے پناہ مانگے. آپ صلی اللہ علیہ وسلم نے جو دعا سکھائی کہ اللہ میں تجھ سے پناہ مانگتا ہوں بری بیماری سے اور پاگل ہونے سے اور برس کی بیماری سے، یہ تمام چیزوں سے. تو بیماری سے بچنے کے لیے پہلے ہم حفاظت کی دعائیں ضرور کریں. بیمار ہو جائے کوئی انسان تو یہ یاد رکھے کہ اللہ کی ناشکری یا شکوہ نہیں کرنا ہے، بلکہ یہ سوچے کہ یہ بھی میرے گناہوں کا کفارہ ہی ہے. اٹس اوکے، یہ کچھ وقت کے بعد، یہ تو مجھے ریئلائزیشن کے لیے آیا ہے کہ میں کتنا اچھا تھا. یہ کچھ وقت کی بیماری ہے، ضرور انشاءاللہ نکل جائے گی. اس کے علاوہ آپ صلی اللہ علیہ وسلم نے یہ بھی بتایا کہ برتنوں کو ڈھانک دیا کرو، مطلب رات میں جب سوتے ہیں خاص طور پر برتنوں کو ڈھانک دیا کرو. پانی کے جو برتن ہوتے ہیں ان کو کور کر دیا کرو، دروازوں کو رات میں بند کر دیا کرو اور چراغوں کو بجھا دیا کرو. یہ سارے کیا ہے؟ پریکاشنری میجرز ہیں. کیوں؟ کیونکہ راتوں میں جب ہم سو جا رہے ہیں، ہم کو اگر کوئی برتن کھلا رہ گیا، ہمیں نہیں پتا اس میں کوئی چیز گر گئی یا کوئی مطلب جرمز، یہ تمام چیزیں. تو اسی لیے ہم نے یہ حفاظت اپنی، یہ بھی پریکاشن خاص طور پہ لینا چاہیے. کوئی چیزیں اگر کھلی پڑی ہوئی ہے ہم نے اس کو کھانے سے دور رہنا ہے. اچھا بہت زیادہ دوائیوں کی جگہ جو ہے ہم نے لائف سٹائل چینج پر زیادہ فوکس کرنا چاہیے. ایسا نہیں کہ کچھ ذرا سر درد ہو رہا ہے تو ہم نے فوراً اٹھا کے دوائی لے لی. اگر کوئی چیز ریکرنٹ ہو رہی ہے، کوئی تکلیف اگر بار بار ہوتی ہے، تو خاص طور پہ اس کے سورس کی طرف جائیں کہ یہ ہو کیوں رہا ہے، نہ کہ صرف دوائیوں کی طرف ہم چیز کریں. اپنی لائف سٹائل چینج میں ایکسرسائز ہے، واکنگ ہے، ہمیں ایکٹیو رکھنے میں، ہمارے مسلز کو مضبوط رکھنے میں اور اوور آل ہیلتھ کے لیے یہ بہت زیادہ امپورٹنٹ چیز ہے. ٹھیک ہے، پھر ہم نے صاف ستھری چیزیں کھانا ہے. फ्रेश चीजें खाए. अल्लाह ताला फरमाते हैं कुलू वशरबू हलालन तय्यबा, खाओ पियो जो पाकीज़ा है और अच्छी चीजें हैं, फ्रेश चीजें हैं, और हद से ज्यादा मत बढ़ो. तो हम चिकनाई वाली चीजें, मीठी चीजें, इन चीजों से हमने बचना चाहिए, क्योंकि ये बेशक हमारे लिए नुकसान की चीजें हैं. अच्छा, हर चीज, हर बीमारी जो है, इट डजंट वांट द आर्टिफिशियल मेडिसिन, मतलब जो ह्यूमन मेड मेडिसिन है, हर बीमारी जरूरी नहीं कि उसी से अच्छी होगी. कई चीजें ऐसी होती है, कुछ डिफिशियंसीज है, जैसे विटामिन डी की डिफिशियंसी है, नॉट नेसेसरी कि हम उसके लिए सबसे पहले दवाइयां ही ले लें. हम नेचुरल सनलाइट के अंदर बैठे, मॉर्निंग का सनलाइट ले, उससे हमें फायदा होगा. अगर विटामिन सी की या फिर कैल्शियम की या आयरन की कमी है, तो उसके लिए हम अपने खाने पीने की चीजों में लेमन है, खजूर है, बीट है, इन चीजों का इस्तेमाल बढ़ा दें, ताकि हम इससे ओवरऑल हेल्थ हमारी बेहतर हो, और इसके साइड इफेक्ट बेशक कुछ नहीं होंगे. फिर फ्रूट जूस की जगह हमने प्रेफर करना चाहिए कटे हुए फ्रूट्स खाएं, क्योंकि उसमें हमारे लिए साथ में जो उसकी ताकत भी जाएगी, और फाइबर जिसे कहा जाता है, जो कि हमारे अंदर से मतलब खराबियों को अगर उसको निकालने के भी काम में आता है. ओके, शहद का और कलौंजी का हम इस्तेमाल करें. और बहुत अहम दो चीजें, नींद को पूरा करें. अपनी नींद का बहुत ख्याल रखें कि हम रात रात जो है सुकून की और सोने का वक्त है. इसको रातों को लेट नाइट जाग कर जब हम अपनी सेहत को खराब करते हैं, तो साथ में शुगर और डिप्रेशन और स्ट्रेस जैसी बीमारियों को दावत देते हैं. तो अपनी नींद को हमने पूरी करने की खास कोशिश करनी चाहिए. इसके लिए भी हमें इंस्ट्रक्शंस जो दिए गए, हमने जल्दी सोने की आदत रखनी चाहिए. ठीक है. और सबसे लास्ट और बड़ी खूबसूरत चीज कि मुस्कुराएं. कीप स्माइलिंग. ये सदका है. इट्स अ चैरिटी. यू नो हाउ इट इज चैरिटी. ये कैसे सदका है? हम किसी को देखकर जब मुस्कुराते हैं, एक इंसान परेशान है किसी इसमें, और जब वो देखता है एक स्माइलिंग फेस, तो अंदर से उसके एक पॉजिटिविटी आती है. हो सकता है कि मैं किसी और की मेंटल हेल्थ को बेटर करने का जरिया बन जाऊं. ठीक है. तो हम मुस्कुराएं, ये खुद हमारी मेंटल हेल्थ के लिए, हमारी दिमागी और सेहत के लिए और जिस्मानी सेहत के लिए अच्छा है. और इसके अलावा ये भी कहा जाता है कि ये स्ट्रेस रिलीवर है, और इनफैक्ट ये इम्यूनिटी को बूस्ट करता है. स्माइलिंग इम्यूनिटी को बूस्ट करता है, और हमारी दिल की सेहत के लिए अच्छी चीज है. तो हम सब पूरी कोशिश करें कि हम अपने आप को सेहतमंद रखें, ताकि हम जिंदगी को बहुत अच्छे से एंजॉय कर सकें, अपने क्रिएटर की बहुत अच्छे से इबादत कर सकें, और खुश रहें, और दूसरों को भी खुशियां बांटें. जज़ाकल्लाह खैर. अल्लाह ताला हम सबको सेहत और आफियत के साथ रखे, हम सबको तौफीक दे कि हम अच्छी चीजों का चुनाव करें अपनी जिंदगी में, अपनी लाइफस्टाइल को अच्छा रखें. आमीन सुम्मा आमीन. अस्सलाम वालेकुम व रहमतुल्लाहि व बरकातहू.
जज़ाकल्लाह खैर बहन नाज़िया उमर, कि आपने हमारे लिए सेहत के इन सारी अहमियत पर रोशनी डाली. Now moving on to the next part of our program. Today we have among us a versatile personality. She is definitely someone who has achieved great milestones in the field of cancer awareness. She has provided medical, psychological, and emotional support to cancer patients. She has also been actively involved in conducting medical camps, awareness drives, educating ladies on the importance of regular checkups, and also assisting underprivileged patients with finding right resources for treatment and taking the right decisions. Apart from such incredible work, she has also presented papers on subjects such as importance of healthy nutrition for cancer patients and management of fertility issues for young breast cancer patients. Currently, she serves as a medical oncologist in the Department of Medical Oncology at the Kuwait Cancer Control Center, and she has also received the prestigious She the Change Nari Udyami Award 2019 at the Pravasi Bharatiya Divas. I would like to invite Dr. Susovana Sujit Nair to share with us her understanding and knowledge about cancer and how it can be managed.
Assalamu alaikum. Am I audible, Hina ji?
Yes ma'am, you are audible.
Yes, you're audible.
So I'll just share my slides. Is it visible?
Yes, it's visible.
So good evening and salam alaikum to all of you. And I should thank Mrs. Nazia and Hinaji for such a kind introduction. And I was just spellbound to listen to Nazia ji. You are such a nice speaker. Really, God bless. God has given you, I should say, His earnest blessings are endowed on you. And you have spoken so well about so many topics. Actually, you have covered so many topics. And you should take up teaching as your utmost profession. You'll really do great job for the community. Everything you have explained so well, and many things you have touched, like how people are losing sleeps these days, how people are not able to close the eyelids these days. I just wanted to add one more point to that, that these are all related to our addiction towards electronic gadgets. So anyway, I really loved listening to you. Thank you so much for having me here today. And I should take this opportunity to thank Ladies Wing of Indian Muslim Association Kuwait for having me here today to speak on important topic like cancer awareness, specifically the cancers which we uh, ladies are more prone to get: breast, cervical cancer, and I'll be touching a few slides with ovarian and endometrial cancer as well. So thank you so much to all of you for joining us today. So if it is possible to have a vision, to have a one without breast cancer, inshallah, we have it someday, right? It is very difficult, but once we vision something, at least we'll reach up to some level, isn't it? So it is always important to understand that we can dream something which is really tough to achieve, and so that we can really try all our efforts and leave no stones unturned to achieve that goal. We can also promise to ourselves today that if we are not able to reduce the incidence of occurrence of cancer, at least we can promise that we'll not let any lady die of breast cancer. And this is only possible if we diagnose the disease early. Because it's not only breast cancer as such, any cancer, if it is diagnosed early, the risk of recurrence will be less or sometimes no risk, and this will not make the person have the fear of dying from cancer. As we all know that we are all afraid of the term cancer. This is because most of the time cancer is getting diagnosed late. If the same cancer is diagnosed early, it can have a complete cure, and the cells will not be remaining back in the body to come back again. My slides, most of the topics which I'm going to cover, you'll find most of them you know it. But from an oncologist's perspective, what I feel that what we are seeing cancer patients day in and out, so the risk factors or the causes, or as Ms. Nazir rightly said, the lifestyle we follow, this has a great effect, or it makes about big changes if we can keep a very healthy lifestyle. The way we eat, what we eat, and whether we are physically active, inactive, and other addictions as such. in the society, sometimes people think that cancer, the term tumor is like cancer. It's not like that, because tumor means, it's a broad term. Tumor means a group of cells which are abnormal to that part of the body. So tumors can be of two types. It can be either benign tumors or malignant tumors. So if those tumor cells have a capacity to invade the membrane is growing. I'm sorry, is there, I'm audible, right?
Ma'am, please you unmute
Yes.
yourself. Because I muted everyone else. You please unmute yourself.
Dr. Susovana, you can continue.
She is muted.
Oh, okay. Please unmute yourself and you can continue.
So, nearly 25% of cancers are because of causes, or actually in present day, if I take just like the immediate statistics, I'll say even more than 25% of cancers are because of causes or risk factors which are under our control. So why not really keep ourselves under control so that we don't get this dreaded disease? Like, we are all afraid of this term cancer because we think cancer means death. But actually speaking, neither cancer means death nor death from cancer is so easy. Yes, it is very true that cancer surely is a disease which can make the quality of life of the person very bad, because cancer also causes cachexia, loss of muscle strength of the body. The person becomes tired, and also the treatments, they have to be stronger than the cancer, because the treatment has to take care of a dreaded disease, a strong disease. So surely the treatment has to be stronger than the disease, and if this treatment is stronger, surely it will have a lot of side effects. So both the disease and the treatment are strong. So the person who is going through cancer treatment surely will be tired. So the quality of life surely becomes bad. But we should not think that cancer means sudden death. You'll never find a person dying of cancer suddenly. We generally have time to treat the patient for some time. The horrible part, or the pathetic part, is if the patient comes to us in a late stage, when it has become systemic, meaning the cells are already in the blood or the lymphatic channels, through which it can go to any part of the body. So, as I said, we cannot stop the incidence. Rather, the incidence of cancer is increasing every day. But the death from cancer is surely on the downgoing trend. This is again because of multimodality of treatment disease and so many different investigation which we can pick up the disease early, and also because of awareness. So the worst line in this slide is that 70 to 80% of cancers are still detected in advanced stage. Why should it be so? The problem is, cancer generally does not start with any of the symptoms which can affect the day-to-day life of a person. Anybody doesn't reach to a doctor unless a problem is occurring which is affecting his day-to-day life. Pain, bleeding, such things will make him really sick, and he feels scared, afraid, and he looks for medical opinion. But problem with cancer is it keeps growing without any issues in the beginning. So generally, the time when the cancer symptoms are really too much, like severe pain or bleeding or loss of weight, the person is like he has really, or she has lost weight badly, that he has to reach to the doctor. By that time, the cancer has already gone to different parts of the body. So we have to be aware. The thing is, whenever a person has some symptoms, okay, So we always correlate those symptoms with the generally occurring infections or inflammations or any other disease of that particular organ. We never want to think that those symptoms could be the signs of cancer as well. And that is also one of the reasons why cancer gets diagnosed late. Say, for example, if a person is developing a stomach cancer, okay, so he or she will not have any new symptoms because of the stomach cancer. If I have, or if somebody has a stomach upset, bowel upset, okay, because of some, say, food which he or she ate which was stale. So what will be the symptoms? Some bloating sensation, some agonizing pain, person may not feel a good hunger, okay, and he may not have or she may not have proper bowel movement. So all these symptoms will also be the same symptoms even if the person is developing a cancer. The problem is we never take cancer in the differential diagnosis. Differential diagnosis means when we think of what all could be the causes for these symptoms of this person. So if we put cancer also in the differential diagnosis, then surely it will be diagnosed very early, whichever cancer as such. We are always discussing about breast cancer, right? You find a pink ribbon month, October, because breast is the commonest cancer in ladies and the cancer which causes maximum deaths in ladies due to cancer all over the world, except for few areas where cervical cancer again comes up. But this is an organ which can be picked up, or the lesion can be picked up by the lady herself or the man. Breast cancer is, it occurs in men also, most of you may be knowing. So if the person himself or herself picks up the disease, then generally the cancer is picked up early. And it is also an organ which is outside the body, so it can be examined easily. But say, for example, pancreatic cancer. It's very difficult to examine a pancreatic mass. We cannot examine. It's deep inside. Similarly, ovarian mass. So we have to be more aware with the symptoms. So if there is a pain in the abdomen and it is not going off with some antacids or some painkillers and it is recurring, please have a checkup. Maybe it may be an early sign of a cancer developing, and the cancer may be picked up at a stage where we can have a complete root cure and the chances of recurrence will not be there. So we have to understand that it is very, very important to understand that cancer does not come with some other symptoms than any other normal disease of that particular organ. As per worldwide statistics, international statistics, generally, lung cancer is the commonest in men. But here in Kuwait, we find that colorectal cancers are more common in men. This is again because of smoking and grilled meat eating. I'll come to that point later on. How does it affect our body? But for women as such, breast and cervix, it keeps on going any part of the world. So I'll not take much of time on these statistics, but just to put it, like you'll find in most of the slides, you'll find that breast really forms a big bunch of cancer patients in ladies. And though men are less, 1 to 3%, or say less than 3% of breast cancer patients are males, but unfortunately, male breast cancer patients are generally diagnosed very late because a small nipple-like structure in males, if there's a small growth growing there in a hairy body, most of the times it is missed out. And as it is painless, moreover, men have a bigger control or threshold of pain. So generally, it keeps on growing in the body till a late stage where the person comes to us with metastatic burden than the disease itself. So here you find breast forms 23% of the cancers. So nearly a quarter of the cancers in females is breast. This slide, I love this slide in our statistics from Kuwait Cancer Control Center. Actually, all of you must be knowing in Kuwait, we have only one center taking care of cancer patients. It's the Kuwait Cancer Control Center under Ministry of Health. And so any patient diagnosed any part of Kuwait have to come here for their chemotherapy. Presently, 2 satellite clinics were starting. We have been somehow running in Jabir and Jahra, but otherwise, cases is the main. So here, In this slide, you'll find the blue lines for females and the red lines for males. So these are the commonest risk factors, as Mrs. Nazia was talking about, the bad habits and our lifestyle. So here you find how smoking, alcoholism, physical inactivity, and obesity, though they look so simple, and we take it for granted that these are nothing, but actually they have a big risk on increasing cancer genesis in our body. Smoking. Why the blue lines, meaning which shows that higher risk of developing cancers in the body in females from smoking? This slide looks ridiculous, right? Generally, we know males are the ones who are smokers. Ladies, we find smokers, but compared to men, generally they are less. Then why is so? This is because it is taking care of all the passive smokers. So, from one man, how many passive smokers can be? Especially, it will be his wife, his daughters, maybe his mother or mother-in-law, elderly lady who is staying at home, and the maidservant, and his colleagues, female colleagues, and the other ladies whom he comes across in the community. So these are all the ladies who are taking the passive smoking burden from this gentleman. So it is not correct to think that if I am not a smoker, I am totally protected from the bad effects of smoke. No, I am totally almost to the same extent or sometimes even affected more. My next slides will show that sometimes passive smokers are actually affected even more because of the toxicity. And the other two, notorious agents are like physical inactivity and obesity. Physical inactivity is becoming very, very common these days. And we take it like nothing. We just say that, yeah, I'm trying to exercise, I go for a walk, but it's not reducing. But we don't take it seriously. That is very important to keep our body mass index maintained. Smoke in any form, whether you take it means tobacco content in any form as chewing element or whether it's a smoking element, everything has its bad effects on our body. Now, we are all afraid of the cancer. Okay, what about the other diseases that tobacco can cause? At least cancer gives us time to go through some treatment. What about heart attacks? Many a times we might have faced situations where we might have talked to somebody in the night and next day we hear a message that the person is no more. And we are not ready to believe that what we hear, because we say we talked to that man yesterday. Yeah, he passed away. Because there are many people in the community who are like heavy chronic smokers and who take life first like so granted that nothing means I will live my life, I'm not having any issues, I'm just a smoker, so I'm not having any problems. But they may be having uh, heart rates high, their BPs may be very high, and they're just tolerating it. Somehow they are controlling their headaches and the other issues related to and it is not diagnosed, and they come out with a sudden heart attack, brain stroke, paralysis. You know what happens? In a chronic heavy smoker, the blood coagulability increases. So the liquidy consistency of the blood doesn't remain so liquidy in a chronic heavy smoker. So the blood becomes sticky and generally it becomes small microglobules. And when they are traveling in the blood, in the small vessels, they can go and block those small vessels. So if they block the most important organ in our body, the brain, then we get a stroke, because the part of the brain which is supposed to be supplied by the vessels after that don't get the blood supply. So we call it a brain stroke or cerebrovascular accident. Similarly, the carotid arteries in the brain, they get blocked. So this happens in the brain. Similarly, when it is coronary arteries, that is the arteries which are supplying the heart itself. Heart is pumping blood to the full body, but there are arteries which are taking blood for the heart's functioning, that is the coronary arteries. So if these small microglobules go and block the coronary arteries, the arterioles, the small vessels, then the circulation to the heart will stop. So this will cause a sudden attack for the heart. So we have to understand how notoriously smoking is damaging our society. Look, look at the other things, everything. We are not only thinking about cancer. Okay, smoke is directly or indirectly related to almost all the cancers in the body. And lung cancer, 90% of lung cancers are directly related to smoking. So it is such an agent, such a notorious agent in the society, a culprit in the society, but we are just taking it for granted. Now, you may ask me that why we don't ask government to stop supplying smoking agents, smoking items. Why don't we stop selling cigarettes? See, whenever we discuss things on upper level, see, this actually alcohol or smoke, these agents bring revenues to the government. So we cannot have a say where there is interest for the government as such. But as public, we have to understand that if anything and everything is available in the market, are we all justified to pick up anything? Why? I can pick up the good things, I can avoid the bad things, that's all. It's on my wish, it's on my zeal what I want to pick up. Not like just because it is sold I have to pick up, in spite of knowing that it is so very notorious to my body. So it has to come from inside. Now, any agent, any agent, chemical agent, or any exposure, radiation exposure, any cosmic radiation, which can initiate a process of cancer, we call them carcinogenic agent. Okay, cancer, genesis means to start, initiate. So carcinogenic agent. So basically, in my first slide, as I said, cancers, it starts from the cells. So what happens in cancer, basically, there is damage to the DNA or the chromosomes. I'll just go a little into the deeper part of it. Actually, in our body, all the cells have small part called nucleus, right? And the nucleus contains the chromosomes or the genes. And these chromosomes or genes are the ones which decide the cell doubling time, when the cell will grow and become 2. Now, if this doubling time is jeopardized or lost by damaging the chromosome or the DNA, then cell starts proliferating and growing in an abnormal and logarithmic rate, a very high rate. Just say, for example, if a cell has to double in 1 minute time, and by damaging the chromosomes, it can double in half a second, then just think how many cells will conglomerate or get accumulated in one particular place in a very short time. So this is what happens in cancer. So any agent, any chemical agent, or any cosmic radiation or any X-ray radiation, whichever agent which can bring about this damage to the DNA or the chromosome is called a carcinogenic agent. And unfortunately, my dear audience, actually 50 such carcinogenic agents are said to be present in cigarette smoke or the tobacco smoke. 50. And just see the names. You'll find some of the contents of the cigarette smoke are like tough chemicals, very hard chemicals which are found in factories. Toluene, ammoniac, urethane. All these names you will not find in general usage. These are all factory chemicals. DDT, you all know DDT is an insecticide which we spread in our fields to kill the insects. You find naphthalene. So also you find polonium-210, and they have, I think, not put another one, lead-210. So there are 2 radioactive agents as well. So you have to understand, say for example, if a person is a smoker, so he takes in, when he inhales, he takes in all these 50 carcinogenic agents inside his body. Now, when he is exhaling, these carcinogenic agents are all coming out mixed with the carbon dioxide of his lung or her lung, and actually their toxicity becomes even higher. So a passive smoker is basically taking more toxic agents than the active smoker. And these radioactive agents, they remain indoor. So a person who smokes outside and says that I've smoked outside, so I've not harmed anybody nearby me, So this is wrong, because actually what happens, some studies have shown that a person who smokes, when he takes out this exhaled air, the contents with these toxic agents are found after many hours as well. It is not like after few minutes or seconds it goes off. No, there are some case studies which are showing even a couple of hours, like 5-6 hours later, after the process of smoking, the person still exhales out, and the smoked and the exhaled air still contains these toxic agents. So it's really wrong if somebody says that I smoked outside, so I am not harming the community. This is wrong. So we have to understand how pathetic it is to be even a passive smoker. So we have really to somehow control on smoking. Most of the cancers you'll find somehow or the other, directly or indirectly, related to cancer risk. And it is said that each cigarette can reduce longevity by 7 to 11 minutes. Are we really justified? Life is so precious, right? We never know which day we breathe our last. Nobody knows. Life is so uncertain. And it is so short. World has so many things to know and enjoy. What all we enjoy, we hardly get time to go through even a few cities in our own country. Then what about the full world? So why to really invite death, and that too in a pathetic way? 90% of lung cancers, as I said, are because of tobacco. But still, people will take it with as a standard of dignity. People who are smokers as well as alcoholics, actually, they are increasing the risk of cancer by 50% compared to other people. You know why? Liver is actually the detoxification center in our body. Every day, through the exhaust gases, environmental agents, so many other toxins which we may be taking knowingly or unknowingly from the fruits, vegetables, unwashed. Or sometimes we are eating canned food, tinned foods. So the preservatives, okay. Similarly, as I said, the vegetables, the DDT sprayed on the vegetables or fruits. Sometimes we may not have time to wash it properly, and we are taking, so knowingly or unknowingly, we are already taking so many agents inside our body. So all these toxins, actually, maybe God knew that we will be doing all these things. So he gave this liver to us so that it can detoxify or cleanse the body from all these toxins. Now, alcohol actually damages the liver, cirrhosis of liver, right? So if the liver only is damaged with alcoholism, then I'm damaging the detoxification center. So I'm a smoker also. So then surely all these toxins from smoke, I don't have a detoxifier. So I'm accumulating all these toxins in my body. So thereby, a person who is a smoker as well as alcoholic actually increases the risk of getting a cancer nearly 50 times more compared to a normal person. Okay. Now, let us see a few slides on cervical cancer. I'll come down to the breast in a bigger way. So, human papilloma virus. Okay, this is basically a cancer which is spread by sexual activity. And some strains of HPV virus, which can cause genital warts, and other strains can cause cancer. Generally, when this virus stays in the body, in the cervical canal for a long period of time, or the penile shaft for a long period of time, then they can bring about genetic changes. Again, same thing, damage to the DNA or the chromosomes, thereby bringing about cancer in that particular organ. So, what we have to understand that these are diseases which are basically more risky in people with unhealthy sexual lifestyle. So for screening, as you know, women who are 21 to 29 can go for pap smear alone or every 3 years, test every 3 years. And we also have another test, something similar to pap smear, which we call HPV test, human papilloma virus, that is also like a smear from the vagina. And these two tests can be done to just pick up if there are cells which will show cancerous cells. In my slides, you can see the age group which should be doing it. But actually, this is, this is again in societies where it is more prevalent. We don't say it for everybody, but surely where it is more prevalent. Cervical screening tests such as conventional cytology, that is pap smear, or the liquid tests like LBC, which we call liquid blood cytology, or even human papillomavirus testing. All these tests can help us to pick up the disease early, where people have a risk, where we are suspecting that these people can have a higher risk. Who needs the HPV vaccine and how many doses? Again, you have to understand what does this vaccine actually do in our body. The HPV vaccine protects against the genital warts and also prevents cervical cancer. It protects against cancer of the vagina, vulva, penis, because these are the areas where the virus can remain back for a long period of time and thereby causing the disease. The vaccine gives the body a safe way to build immune system. So the person gets the immunity to fight out these viruses so that they die, so that they don't have a time to bring about genetic changes or initiate the process of cancer. Again, as per the FDA approval, Gardasil 9 vaccine is approved. Again, you find the age groups where we can give. And once a person gets HPV, the vaccine may not be as effective. So we also have to understand in those areas where the risk is very high, we have to really start it from a very young age. Otherwise, if the person doesn't have risk, it can be given at a later age as well. People younger than 15 can be vaccinated with 2 doses, which should be 6 to 12 months apart. The CDC suggests catch-up HPV vaccinations for all people throughout this age group. Again, it is for the areas where it is at a high risk. I'm not saying this is for everyone. Okay. Now, let us talk a few slides on endometrial cancer or the uterine cancers. Okay. Generally, breast cancer is the commonest. We say the incidence is 1 out of 8 ladies, meaning if 8 ladies without a family history of breast cancer, they live till 70 to 80 years of age, then 1 of them will get a breast cancer. This is the incidence of breast cancer. But in case of endometrial cancer, it is less. It is hardly 1 to 2%. But we find it mostly in elderly population, postmenopausal ladies, and we have to understand that these again are related to our hormonal exposure as well. Women with increased level of natural estrogen. One thing you have to understand that breast cancer, ovarian cancer, endometrial cancer, these are also estrogen dependent cancer. If the estrogen exposure to our body is high and for a long period of time, we have a high risk of developing these cancers. That can be because of any reason as such. I'll come down in a more clear way. What are the different ways we get exposed to them? Like for postmenopausal, as you find here, hormone replacement therapy, even overweight. Overweight, how does it affect? Once we are postmenopausal, we understand that our ovaries are not working. But if we are obese when we are postmenopausal, it is said that there are enzymes which can change the extra fat in our body to estrogen. So actually we call them as extra endocrinal organ for production of estrogen, which is really very scary to understand that it's the fatty tissue in our body which can produce estrogen. It is generally estrogen is a hormone and it should be produced in an endocrine organ like ovary. But a postmenopausal lady where the ovaries have stopped functioning, they still can get more exposure to estrogen by being obese. So we have to understand how important it is to keep our body mass index controlled or under in a limit or not in the correct way, so that postmenopausally we are not obese. Some of the symptoms the early symptoms for endometrial cancer: abnormal uterine bleeding, difficult or painful urination, pelvic pain. And what we do generally, we do DNC, to check whether there is something growing inside, to get some cells to do tissue diagnosis, to diagnose the case. Ovarian cancer, again, though the incidence is less, but ovarian cancers are even worse than breast, because ovary is, they are generally diagnosed late. Ovaries are two small organs growing in a place where there is large space to grow. And as I said, cancer doesn't come with during early stages, they don't come with symptoms. So they keep on growing. And many a times the lady gets diagnosed when somebody tells her that, are you pregnant? Because your belly looks big. And she wants to really check up what is happening. I'm having my periods, I'm not pregnant or anything, but why my belly is increasing? I'm not becoming obese but my belly is increasing. And when they do a sonar and they find that there's a huge mass which is originating from the ovary. And then after surgery, the biopsy comes as it's an ovarian cancer. So though the incidence is less compared to breast cancer, but ovarian cancers are really, really very bad, because most of the times we diagnose them at a very late age. Here again, you find this reasons or the risk factors are almost same, that high level of estrogen in the body. And for ovarian cancers, we can do a blood test called, it's a tumor marker. It's CA125, with which we can keep ourselves under check whether our ovaries are doing good or there is some issue growing inside it, and that can be picked up by this test, CA125. Okay, and also transvaginal ultrasound. But generally, ovarian cancers we don't expect in everyone, or the risk is not, the incidence is not that high. But surely, where there's a family history, then surely those ladies should be under close follow-up with these two investigation modalities. Pap test, HPV test may be done with or without a pap test to screen for cervical cancer. So these are again tests that needs to be done for people who have to be kept under close follow-up, and also who think that they are at high risk and they really want to have a checkup to get diagnosed early. These are some of the other risk factors for any cancer as such. High intake of animal fat increases the risk of stomach cancer and colon cancer. Grilled food. I was telling in the beginning that colorectal cancers we find more in men here. Why so? Grilling, actually grilled food, all of us like, right? What happens? All these non-veg items, meat, mutton, chicken, fish, all these, they are all proteins, right? So proteins means they are made up of amino acids. So what happens when you are cooking in open fire, any non-veg item, especially those which have large content of blood, like meat, mutton, there's a chemical change in the amino acids. And these amino acids tend to change to something called tricyclic amines, which are again carcinogenic. So on a routine basis or regularly, when we start taking grilled non-veg item, we are actually exposing our food pipe to more of these carcinogenic agents. You have to understand one thing here. Mostly it's the ladies who are listening to me. So all of your mothers, you have to understand that it is very important to protect our children, especially from getting this disease risk later on in their life, which is maybe because of our unhealthy eating habits created for them. If you are making them regularly eat grilled items, non-veg item, vegetable item when you grill, it has nothing to do. But especially meat and mutton, when you are grilling, you are actually making many of these amino acids into tricyclic amines, which are carcinogenic. And that can actually, when it is going through the food pipe, that can damage the DNAs, and there may be a risk of getting colorectal cancer later in their life. So when you are giving your kids, don't make it a regular habit. At least keep a gap. God has made this body very strong. There are multiple modalities to rectify the damages that occurs in our body because of these nasty items. But even smoke, whatever the bad things, but the junk foods and all these things. So, but what happens whenever you are using the same junk or same grilled item every day, day in and day out, every day, regularly for a long period of time, then this rectification mechanism may not work. And there is the time where the person may develop a sign or early symptoms of cancer. And as I said, the cancer will never grow overnight, and it will never be seen so easily when it is very small. So the person may be suffering from the disease after, say, 10 years. And if it is our children, we may not even be there to take care of them. And it is the disease which has been given by us. So please don't make it a regular habit. Intake of charred and burnt foods. Reduce. When your food gets burnt off, please remove the black parts, because they may have some carcinogenic agents in them. Prolonged radiation exposure. Always try to avoid X-rays as far as possible. Even if your physician suggests that you need to get one X-ray, being the person who yourself or your children who are going to get the X-rays, you have all rights to ask your physician, do you really need it? I got the X-ray done some time back, because I've heard that it can damage my cells and I can get a cancer. So your physician knows that you are not a layman. You have knowledge, and you understand that these X-ray radiations can directly go and damage the DNAs and thereby initiate a process of cancer. So reduce. It's not like you should stop, because X-rays picks up many things. Similarly, mammograms picks up cancer in stage 0 level also. So, but we have to understand that multiple repeated at frequent intervals can be really, really scary to our body. Okay, so as we said, that cancer develops in the body silently with no or minimal symptoms. This is the reason why cancer generally gets diagnosed late. So awareness is of utmost importance. These are some of the other early signs which should be taken as important to reach to a doctor to get diagnosed whether it is really cancer or something else. When we get sore throat, we all get sore throat, right? Whenever there is a change in the weather. So sore throat in a smoker may be an early sign of a cancer development. So whenever a sore throat is not healing off within a week or 10 days time, please have a checkup. Have an endoscopy to check whether everything is okay with your vocal cords. Chronic nagging cough. These are all symptoms. Actually, as I said, cancer does not have any symptom which is different from any other normal disease of that particular organ. So it is our awareness, our knowledge to think or keep even cancer in the differential diagnosis so that we can pick it up early. Prolonged heavy bleeding during menstruation. It can be because of fibroids. But if you do an ultrasound of your uterus and you find that there are no fibroids, then surely have a checkup with your gynae to find out whether there is some other lesion which is causing heavy bleeding. Bloating sensation in the stomach, as I said. So now let us discuss breast cancer as such.
Doctor,
So,
Doctor, I would just like to remind you that we have 5 more minutes to go with the program.
Okay.
Yeah.
So, breast cancer is not only limited to females, it is both males and females. So it's only the lobules, you see, in female breast, the lobules are there for milk formation, which is not there in males. Otherwise, males also get cancer in any of these parts, like the ducts, the tubes, or the other areas of the breast, because anatomically it's almost the same, except the extra fat and the lobules which ladies have for milk formation. 4 types of cancer in breast generally we find. These are either in the tubes or in the lobules. And there's another cancer called Paget's, which starts like eczematous lesions in the breast. And also there's another type of cancer, which I'll show in the picture, which is called inflammatory breast cancer. So I'll come to that here. Now, when we discussed about the risk factors, you have to understand that there are risk factors to which we don't have a say. Those are because of our, which are not modifiable. Being a lady, being a woman, aging. most of the things that we are exposed to in our day-to-day life is more when we are more aged compared to a young child. So surely aging is a risk factor. Now, if you see the green part of the slides, these are showing the risk factors which are under our control. So if you see here, most of them like obesity, radiation exposure, sedentary lifestyle, alcoholism, hormone replacement therapy, all these can be under our control, and thereby we can reduce the risk of the cancer. So what all generally we look for? In the breast, either we look for a swelling or lump, skin irritation, breast pain, inverted nipple, redness, scaliness. Actually, any subtle change which you feel that it was not there before and it is seen now, you have to be concerned that this should be checked up, whether it is a early sign of a cancer. Remember, whenever you are examining yourself, underarm swelling, you have to pick up always with a seriousness, because many times people think that they only have to look for the breast. No, there are cancers where the growth is not yet seen in the breast, but already there's a big lymph node or a swelling in the underarm area. So those are actually very aggressive cancers where the cancer has already gone to the lymph node and growing, but it has not yet seen in the breast. But during your examination, you have to be very particular that you are examining your underarm area also. So these are basically the symptoms which we look for. We look for any lump or nodularity in the breast. We look for any crustation around the nipple. We look for any bloody discharge from the nipple. We look for, this is what is called inflammatory breast cancer, where we don't find one lump or anything, but the full breast changes into a hard, painful lump, which we call inflammatory breast cancer. You have to understand one thing, bloody discharge from a lady who is premenopausal, who still has periods, in most of the cases, it may be an early sign of a cancer. But if it is an elderly lady, postmenopausal lady, there are many benign diseases which can cause nipple discharge. But surely, a blood from the nipple has to be digged into it to find out exactly what is happening. For screening, mammograms are the best because mammograms can really pick up very early cancer. And as it is saying, lowers risk of death by 15%. This means that if you can pick up the disease early, the risk of cancer coming back is less. So it reduces the incidence or the risk of deaths from cancer. So mammograms, and also there are timings like when it should be done. So above 40, generally we say for normal people, but if there is a family history, surely it comes down to at least 10 years before 40. So from 30 years itself, the lady should start getting her checkups done, either ultrasound or mammogram based on the consistency of the breast. If it is a hard, dense breast, ultrasounds generally have a better pickup. But if it's a lax breast, soft breast, mammograms always have a better pickup. So these are the things that we do to diagnose or to find out the prognosis of the patient. Like we do a staging workup to find out whether the cancer has gone to any other parts of the body. This will again help us in staging to find out what treatment, as per today's date, evidence-based, what is the best treatment for that particular person. So surgery, radiotherapy, and drug therapy, these are basically three modalities of treatment. So first is always surgery. Like if a person is eligible for surgery, then she or he should always undergo the surgery first. And the other treatments, whether it is a systemic treatment, chemotherapy, or a radiation therapy, these are always like a help to the surgery to get a better effect of the surgery. But basically, the first and foremost treatment of any cancer as such is surgery, if it is feasible. So for screening, we have to understand that screening can diagnose early stage disease, and early stage means again, it is curable. The most important thing is we have to understand that breast cancer is curable provided diagnosed early, and that is by awareness. In cancer treatment, we don't have any magical cure. We don't have something like abracadabra and the cancer goes off. But if there is something magical in cancer treatment, it is physical activity. By physical activity, that is by oxygenating your body, you are not only helping cancer not to occur in your body, but also in cancer patients who are going through treatment, they get a better effect of the treatment if they are physically active. To all our patients who are on chemotherapy, though they are tired, they are having vomiting, nauseated, but still we tell them, whenever possible, go out at least for half an hour in a green area and take in lot of oxygen and water, hydrate your body, because the cancer cell kill is enhanced by oxygen and water. So it is very important that we keep our body cleansed with these two items. It also reduces the risk of so many other diseases. Okay, so when the blood circulation is fast, you are actually reducing risk of many diseases in our body, not only cancer. So it keeps your even blood pressure under control. The last thing is that we have to make our food plate very colorful. It should be rich with vitamins contained by the vegetables and the fruits. It should be colorful with multiple colored vitamins and fruits. Why? Because every vitamin, every fruit or vegetable may have something or the other which is going to help you out in increasing your immunity to fight out cancer and many other diseases as such. So as mothers, we have to see that we are really following this, at least for our kids. So limit processed meat and red meat intake. Also, eat at least some raw fruits and vegetables, as they tend to have higher content of immunity containing factors in them. Do not cook oils on high temperature. Again, this is said that when we overeat the vegetables, actually we are destroying all the vitamin content in them. So the way we cook our food, that also has a big value in our health lifestyle. Reduce intake of barbecues. For self-examination, generally you have to find out a date like 7th to 10th date after your menstruation for ladies who are premenopausal, and you have to whenever you're examining yourself, you have to first understand what are the normal abnormalities in your breast. So first thing is, look at both your breast, and as all of us we know, since our childhood we're seeing that we may find both our breasts are not the same size, or both the nipples are not at the same level, or one nipple may be already retracted, or one nipple may be propped out, or one nipple may be just tilted somewhere else. So you always have to understand what are the normal abnormalities in your breast so that you can pick up the abnormal abnormalities. The second position is, she hangs her breasts in this position so that any lump or nodularity becomes more prominent. Also, when she puts her hand behind her head and pushes the chest wall forward, the breast flattens, and that also helps the lesions to be picked up in a much better way. It becomes more obvious. Never forget to look at the lower part of the breast, especially those ladies who have large breasts or who are obese. The lower part of the breast is most of the time missed out, even when you are examining in front of a mirror. So you have to lie down and examine yourself in a much better way. So when you're palpating your breast to find out any lesion, always palpate with the palm of your fingers, not with the tip of your fingers. And during palpation, you have to press it literally hard. That means you are pressing your breast tissue in between the palms of your fingers and the ribs, so that you can pick up any subtle change, any small growth, any grain-like structure, or any small indentation in the skin. All these can be early signs of cancer. Need not necessarily you have to look for a lump. A lump means already it's a large tumor, but you have to look for some subtle changes which are occurring on your breast. Press the nipple and find out if there is a bloody discharge. That also will help you to find out whether there is something growing inside in the retroareolar, that is the posterior part of the breast. Now, lie down. When you lie down and examine, the breast flattens. So all the findings which you went through all this while, you can just clarify it in a much better way because the breast is flattened. So you can examine and pick up that particular nodularity and take opinion of your physician. So mark the calendar. For those ladies who are premenopausal, who are still having periods, please keep it 7th to 10th day after periods. And for those ladies who are postmenopausal, you can keep any particular date of the month. But please, please never examine yourself daily, because once you examine daily, you cannot pick up any new finding. Always give a gap so that you can pick up the new changes. So self-breast examination of the breast once a month, 1 week to 10 days after the end of your menstrual cycle. Seek medical attention in case of any doubts. Don't feel shy. Don't think it as a stigma, because many a times ladies feel that this is such a simple thing, my doctor may laugh or feel I will be like made fun of. No, no doctor is sitting there to make fun of you. You have all rights to clarify your doubts. Reach to your doctor, even if it is a small pimple, and get it clarified that it is not something which should have been ruled out before it is too late. So breast cancer is curable, provided diagnosed early. Thank you so much for the kind audience. I'll stop here. And if there are any questions, thank you so much for that.
Thank you, Dr. Susovana, for sharing with us the causes and the positive response towards cancer awareness. We'll conduct the question and answer session soon too. Now, I would like to hand over the program to Sister Salia Mohsin, who will be our host for the rest of the evening. Sister Salia, over to you.
Jazakallah khair, Sister Hina. Assalamu alaikum wa rahmatullahi wa barakatuh, dear listeners. Moving forward, it's time for some announcements. After announcements, we have our question and answer session, so please be ready with your queries. Human Welfare Foundation विजन 2026 के तहत IMA यानी इंडियन मुस्लिम एसोसिएशन कुवैत बहुत से खैर के कामों को अंजाम देते आ रही है। खिदमत खल्क यानी सोशल सर्विस एक ऐसा डिपार्टमेंट है जिसके थ्रू कौम के कमजोर तबकों की मदद की जाती है। सही मुस्लिम की हदीस है, अल्लाह ताला अपने बंदों की मदद में उस वक्त तक रहता है जब तक बंदा अपने भाई की मदद करता रहता है। मैं आप सबसे गुजारिश करती हूँ कि आप सब इन अनाउंसमेंट्स को गौर से समाअत फरमाएं। फर्स्ट अनाउंसमेंट यतीम बच्चों यानी ऑर्फन्स के कफालत के रिगार्डिंग है। यतीम बच्चों की कफालत और उनकी सरपरस्ती को इस्लाम में बड़ी अहमियत दी गई है। यतीम बच्चों को सहारा देना हम सबकी जिम्मेदारी है। जैसा कि आप स्क्रीन पर देख रहे हैं, एक यतीम बच्चे की कफालत पर मंथ 7.5 केडी है और ईयरली 90 केडी है। इसमें एक बच्चे का कंप्लीट ईयरली राशन, कपड़े, पढ़ाई और रहने का इंतजाम किया जाता है। इस प्रोजेक्ट में 2 या 3 सिस्टर्स भी मिलकर हिस्सा ले सकती हैं। ये लॉन्ग टर्म कैंपेन है। अबू हुरैरा रज़ियल्लाहु ताला अन्हु से रिवायत है कि रसूल सल्लल्लाहु अलैहि वसल्लम ने फरमाया, अपने या किसी गैर यतीम की किफालत करने वाला और मैं जन्नत में इन 2 उंगलियों की तरह करीब रहेंगे, बशर्त ये कि वो अल्लाह से डरने वाला हो। इमाम मालिक रहमतुल्लाह अलैह ने शहादत और दरमियानी उंगली की तरफ इशारा किया। सुभान अल्लाह। प्यारी बहनों, उम्मीद है कि आप इस कार्य खैर में जरूर अपना हिस्सा डालेंगे। दूसरा प्रोजेक्ट एहसास है, जो कि स्क्रीन पर विजिबल है। खाना खिलाना एक अजीम इबादत है। ये अंबियाओं की फितरत और सिफात है। भूखों को खाना खिलाना जन्नत में ले जाने वाला अमल है। प्यारी बहनों, प्रोजेक्ट एहसास में गरीब, मिस्कीन और जरूरतमंदों को खाना खिलाने का इंतजाम किया जाता है, जिसके लिए मंथली 3.5 केडी और ईयरली 40 केडी है। उम्मीद है कि आप इसमें बढ़कर हिस्सा लेंगे और एक अजीम अजर से मुस्तफीद होंगे इंशाल्लाह। तीसरा प्रोजेक्ट खिदमत खल्क का एक और कोशिश है, जो कि वुमेन एम्पावरमेंट है। वुमेन एम्पावरमेंट मुहिम, इसके तहत कई स्कीम्स चलाई जाती हैं, जिसमें एक स्कीम विडो सपोर्ट है। इस स्कीम में 11 केडी 250 फिल्स मंथली और 135 केडी ईयरली है। इसी प्रोजेक्ट के तहत दूसरी स्कीम मेंस्ट्रुअल हाइजीन स्कीम है, जिसमें ईयरली 3 केडी 250 फिल्स का कंट्रीब्यूशन है। इस स्कीम के तहत ऐसी जगह जहां लेडीज के लिए बिल्कुल भी सैनिटाइजेशन का इंतजाम नहीं है और वॉशरूम्स अवेलेबल नहीं है, वैसे गांव और कस्बों में सहूलत फराहम की जाती है। अगली स्कीम स्विंग मशीन स्कीम है, जिसमें 32 केडी पर मंथ कंट्रीब्यूशन है। इस प्रोजेक्ट के जरिए وہ لیڈیز جو سوئنگ کی صلاحیت رکھتی ہیں ان کو اسمال بزنس اسٹارٹ کرنے کی میں ہیلپ کی جاتی ہے. مزید معلومات کے لیے اسکرین پر دیے گئے نمبرز پر کانٹیکٹ کریں. ایک وومن ہونے کی حیثیت سے میری اور آپ کی ذمہ داری بنتی ہے کہ ان کے حق میں جو مدد ہو سکے ہم ان کو فراہم کرائیں. ویژن کا اگلا پروجیکٹ گرلز ایجوکیشن کا ہے. اسپیشلی گرلز کے لیے میوات ہریانہ میں ایک کالج بنایا جا رہا ہے. آپ جو سلائڈ دیکھ رہے ہیں یہ کمپلیٹ پروجیکٹ کا پلان ہے. وہاں کوئی ہائر ایجوکیشن کا انتظام نہیں ہے جس کی وجہ سے ہمارے یوتھ کا فیوچر انسرٹن ہے. اس پروجیکٹ میں آپ اپنی خوشی سے جتنا حصہ ڈالنا چاہیں ڈال سکتی ہیں. قرآن میں سورہ مومنون آیت 10 میں اللہ تعالیٰ فرماتے ہیں اور ہم نے تم کو جو مال دیا ہے اس میں سے اللہ کی راہ میں خرچ کرو اس سے پہلے کہ تم میں سے کسی کو موت آ جائے. یہ پروجیکٹ ہمیں اپنے مال کو صحیح جگہ پر لگانے کی اپرچونٹی پرووائڈ کرتے ہیں. تو آئیے یہ عہد کرتے ہیں کہ ہم ان پروجیکٹس میں بڑھ چڑھ کر حصہ لیں گے. اللہ اسے ہمارے لیے دنیا اور آخرت میں صدقہ جاریہ بنائے. آمین. صحیح مسلم کی حدیث ہے صدقہ آخرت کو سنوارتا ہے. حضور صلی اللہ علیہ وسلم نے فرمایا انسان کہتا ہے میرا مال میرا مال، حالانکہ اے انسان تیرا مال تو وہ ہے جو تو نے کھا کر ختم کر دیا اور پہن کر بوسیدہ کر دیا، صدقہ کر کے آگے بیچ دیا. سبحان اللہ. اب دو بہت ہی دلچسپ اناؤنسمنٹس ہیں، غور سے سماعت فرمائیں اور اپنے کیلنڈرز میں نوٹ کر لیں. IMA LadiesWing کی جانب سے ہر سال کی طرح اس سال بھی کچھ کمپٹیشنز آرگنائز کیے جا رہے ہیں جن کی ڈیٹیلز اس طرح ہیں. پہلا کمپٹیشن ہے ایسے رائٹنگ کمپٹیشن جس کا ٹاپک ہے یونٹی آف مسلمز امپورٹنٹ نیڈ آف دی آور. اردو میں مسلمانوں کا اتحاد وقت کی سب سے بڑی ضرورت. اس کے گائیڈ لائنز ہیں لیڈیز ابو 25 ایئرس جو کہ کویت میں رہتی ہیں. لینگویج آپ اردو، ہندی، انگلش اور رومن اردو یوز کر سکتے ہیں. اس کی ورڈ لمٹ ہے 700 ورڈز. ہینڈ ریٹن اور ٹائپ دے سکتے ہیں، سافٹ کاپیز نہیں ایکسیپٹ کی جائیں گی. اور اس کے لیے رجسٹر کرنا ضروری ہے. رجسٹر کرنے کے لیے نمبر نوٹ کریں 66379828 اسکرین پر ویزیبل ہے. ایسے سبمٹ کرنے کے لیے ہر ایریا کے نمبرز دیے گئے ہیں جو کہ اسکرین پر ہیں، آپ نوٹ کر لیں. ونرز کو ایکسائٹنگ پرائزز دیے جائیں گے. اس کا لاسٹ ڈیٹ آف سبمیشن ہے 30 نومبر 2023. دوسرا کمپٹیشن اینول حفظ کمپٹیشن ہے جو کہ جنوری میں ہوگا. یہ انڈین لیڈیز اور 13 ایئر سے اوپر کی لڑکیوں کے لیے ہے. اس میں دو گروپس ہیں. پہلا گروپ ہے 24 ایئر سے اوپر کی لیڈیز کے لیے، اس کے لیے سورہ یاسین ہے. اور دوسرا گروپ ہے 13 to 23 ایئرس کا گرلز کے لیے جس کے لیے سورہ ملک ہے. اس کے لیے بھی رجسٹر کرنا کمپلسری ہے. رجسٹر کرنے کے لیے فلائر پہ دیے گئے QR کوڈ کو اسکین کریں یا اسکرین پہ دیے گئے نمبرز پر کانٹیکٹ کریں. اب ہمارا کوشچن آنسر کا سیشن ہے. Now it's time for question and answers. So please come up with your queries. Our speaker, Dr. Susovana Sujit Nair, will address your queries. One request, please keep your questions in line to the topic. Okay, the first question we have is, what about the electronic cigarettes and shisha that people use?
Shisha is almost the same because shisha is also containing the same tobacco content. Okay, and basically shisha takes the bad content more deeper into the lungs because the person who is inhaling has to pull it quite hard because it's a long tube. So basically the diseases they get are on deeper part of the lung. So it is almost the same. Electronic cigarettes, sometimes they say that it can be even more risky, more harmful because the contents of the particles are even more smaller. So it is not like by e-cigarette we have reduced the risk of smoke-related diseases in our body. No.
Okay, thank you, ma'am. The next question is, no period, only cramps are there and stabbing pain flow starts almost after 48 hours. Is this normal?
So you mean to say that the periods are going to come, and for 48 hours you get pain and then you start bleeding, right? What I understand?
Yeah, that's
Yeah. So see, actually, premenstrual pain, it can be because it's a hormonal change occurring that time, and the hormones are making the uterus contract so that all this content comes out. So if it is this pain goes off once you start bleeding and the pain goes off, then nothing to worry.
okay. So sisters, if there is any more question, you can raise your hands. Please raise your hands to ask your questions. Okay, one more question is there, ma'am. Is it
Yeah,
normal
it's
to have slight
normal.
on and off breast pain before the periods?
Yeah. We call it premenstrual mastalgia. Generally, before periods, say for 1 week or 10 days, we may start getting a mild pain in the breast. You may feel the breast like engorged, heavy. So this is common. This is again estrogen related.
Okay, thank you so much, ma'am. The next question is, after keeping Marina loop, no period for 1 hour, is it okay?
Actually, I'm not a gynecologist, but I think after 1 hour, for 1 hour, it should be fine. Nothing to worry. That question should be more particular for a gynecologist, actually. I'm an oncologist, basically. Okay, so I think you can have a word with your gynecologist for a better opinion.
Thank you so much, ma'am. Another question is a hormone changing is hormone change one of the cause of breast cancer?
Yes, sure. As I said, if we are exposed to high level of estrogen for a long period of time, then we are increasing the risk of a breast cancer. Due to shortage of time, I could not put that slide for a long time. See, actually, once we get menarche, that is when we start getting our periods, when we are say 12 years or 13 years, what is happening? Estrogen level is high because our ovaries start functioning, and this estrogen helps in proliferation of the breast tissue. So after menarche, we start getting our breast size increasing. Now, if this estrogen is really very high due to any cause for a long period of time, we are actually exposed to this proliferative effect of estrogen for a long time. And proliferation, if it is in a big way, then surely it can lead to a cancerous proliferation. So those ladies who get early menarche or late menopause, means they have periods for a longer period of time, surely they have a higher risk of developing a breast cancer compared to a lady who gets menstruation, say at 12 or 13 years of age, and gets an early menopause, say at around 48 or 49 or below 50. You'll find there are ladies who keep on menstruating after even 50. There are, like we have seen ladies who are menstruating properly at 57, 58, normal bleeding. So they feel it is very good because they still have that strong feminism in them and they still can bear children. But actually, from cancer point of view, this is a very high risk. But similarly, if a lady gets menopause, say at 47, 48, though she may start developing postmenopausal symptoms like hot flashes or difficult sexual life, but still from cancer point of view, actually she is very safe. Similarly, uh, any other modalities by which we are increasing the external entry of hormones in our body, say for example using contraceptive pills or using any sort of an hormone to destroy a pregnancy, that is for abortion, a patch, a hormonal patch or an injection or tablets to just take out the pregnancy, all these are actually keeping risk for later life for breast cancer, because these are all estrogen actually. Similarly, for ladies who are postmenopausal and who are not able to tolerate the postmenopausal hot flashes, or if anybody, even young, who had unfortunately to undergo removal of both the ovaries because of, say, some issues with the ovary, not necessarily cancer, any other disease, and she had to undergo removal of both the ovaries at a young age. So that means she becomes postmenopausal at that at that young age, and so she is not able to tolerate all these hot flashes and her dyspareunia and many other things, like she may not be feeling sleepy properly, and all these issues which are affecting her day-to-day life. Then generally they are given hormone replacement therapy. This is again estrogen basically. So they again have a high risk. People who go for IVF or IVU, these are again hormones to increase the fertility. So they always have a higher risk. So hormones surely have a higher risk in developing cancers. So whoever has history of having gone through any of these things, they should be under close follow-up to pick up any disease in the breast, even if she is totally asymptomatic.
Thank you so much, ma'am, for such a detailed response. Now, another question is, can fibroid cause breast cancer, and how can we prevent fibroids?
No. Generally, in breast and ovary, you'll find in uterus, you'll find fibroids. Like many of us, if we do ultrasound, we find there is some fibroadenoma in the breast. And it is very common in the younger ages when the ladies start their menarche and we find there are lumps in the breast. So generally, we don't have a study which shows that fibroadenomas can change to cancer. But surely they can grow and keep on recurring. So unless your surgeon says that, yeah, it is very big and cosmetically it is not looking good, you need not remove it. If it is small, just keep watching it. Have ultrasounds every 6 months or every 3 or 4 months and check the size and check whether it is just fibroadenoma or it is developing some other fibroadenosis, such sort of thing, or fibrocystic changes. Then those ladies have to be kept under more close follow-up, and even sometimes we may have to do a biopsy to pick up that there is nothing malignant growing inside them. But otherwise, a clear-cut fibroadenoma generally don't change to a cancer.
Thank you so much, ma'am. Another question we have is pain in vagina at the time of intercourse. Is this a sign of a particular disease or anything serious?
There can be many issues. See, if it is a recent onset, just check it up whether there is any infection in the vaginal area, any surrounding area, any infection. Okay, this is the commonest thing. Second thing, if it is chronically happening for a long time, and it's not only that she is having dyspareunia, we call it dyspareunia pain during intercourse. So if she is having it only dyspareunia, and also we have to check it up whether she has lower pelvic pain, means the lower part of the abdomen there is pain, then we have to rule it out that she's not developing something like endometriosis. So please have a checkup with the gynae to check that other parts, the fallopian tubes, the ovary areas, all these look okay, or there is some inflammatory or infective pathology going on. But if the pain is also added to with little blood tinged discharge, please have a checkup whether there is any cervical mass, because that is one of the flag signs, for cervical cancers, to get blood after intercourse. So if it is not no blood content, but it is only pain, have a checkup whether it is an early sign of any infection or even an endometriosis.
Thank you so much, ma'am. We have another question. Can we use any herbal treatment with cancer treatment tablets?
Generally, if a patient is on chemotherapy, during chemotherapy, we don't prefer any other added treatments, because many a times we may not find a study to show whether the chemotherapy has any interaction with that particular treatment, and the effect of the chemotherapy may come down. And we never want a patient to go through chemotherapy in the second time again just because the first time the chemotherapy did not work. So we have treatments like hormonal treatment, we have biologic treatments, but generally they're all sequential, one after the other, but not together. We generally don't prefer or advise any herbal treatment during chemotherapy.
Thank you so much, ma'am. Here's one other question. this person is having pain in the lower abdomen after third delivery. Now, the scanning shows swelling in the intestines. Is this anything serious?
Swelling in the intestine.
Yeah. Pain in lower abdomen and scanning shows swelling in the intestines.
So actually, will not get a term like swelling in the intestine. Have they mentioned inflammation?
Yeah, maybe that is inflammation, but this says scanning shows swelling in the intestines.
Scanning.
Mubina Taj, if you could be more clear with your question, you can raise your hand.
You can just read that report, because generally in a report it will not be written like there's a swelling in the intestine. It will be mentioned edema, erythema, such sort of a thing. So that generally shows it is some inflammatory process going on. But surely we have to take care whether it is inflammation, just like that in infective pathology, or we have to find out whether something else is growing inside. If the person is here, can she just read the report?
Mubina Taj, if you could be more clear with your report, if you can read your report. Till then, we can take another question. Very interesting question. Just now you said grilled food causes cancer. But what about using oil for frying foods and deep fry? Grilled food is better than that.
See, actually, it's not like grilling food cause cancer, but grilling causes chemical changes in the amino acids. So, chronically or regularly for a long period of time when we eat, then we may be taking lot of these carcinogenic agents. So these carcinogenic agents over a long period of time, repeated intake, can bring about changes in the DNA, thereby increasing the risk of the cancer. But it's not like we cannot say directly grilling causes cancer. No, it has to be at a proper interval. It should not be regularly. Like there are people who take grilled items maybe 3 times in a day. Surely that is not justified, or that is not advisable. But if the person takes, say, once in 3 days, once in 4 days, nothing to worry. Because whatever damage, if at all there are some carcinogenic agents in that grilled item, and it's not like all the grilled will have, but generally grilling can change. So we don't have something to pick up like whether this grilled item has it now. Okay. So we have to understand that if it is, this one can contain, so let me not take it in a regular basis. So keep some gaps, keep some frequencies in their intake, so that you're not exposing your body to those suspicious contents on a regular basis. And high temperature oil cooking generally is again not advisable, because first thing, you're already destroying the vitamins which are present in the oil. Also, when you're cooking something that also at a very high temperature, if it is a vegetable item, basically you're destroying all the vitamin content of it. So this also says that you are actually reducing your immunity, and cancer is a disease which is more prone when our immunity is low. In one of the slides, I said that we all are developing cancer cells every day in our body. Okay, but all of us are not becoming cancer patients, right? Why so? This is actually because of our lifestyle. If we have a sedentary lifestyle with lot of junks, no movement, no no going outside, like we are not at all exposed to the fresh air, oxygen, then actually we are giving the cancer cells a very good environment to get cultured and grow and take a full-blown picture of a cancer mass in our body. But if we are really physically active, we go out and take sunlight and increase our immunity level, we take a lot of fresh oxygen in our body, then actually we can kill those cancer cells in our body. Because studies say that cancer cells cannot grow in a highly oxygenated environment. And we have treatment also with oxygen, like we call it hyperbaric oxygen. People with some sort of, systemic cancers, where like blood and lymphomas, we have some treatments where the person is kept inside glass chambers, where full body is exposed to high pressure oxygen, thereby killing the cancer cells in the body. So same thing goes to a normal person. If we take a lot of oxygen in our body, even if there are some cancer cells growing inside our body, we can kill them, or we can have a control over their growth, not letting them to take a full-blown picture of a cancer mass.
Thank you so much, ma'am. This question is regarding the previous question. What you asked about the detailing of the report. The report says bowel thickening is in left iliac fossa.
Yeah. So bowel thickening, this thickening term is not a good term actually. Thickening means the, that the layer of the wall of that bowel portion in the left iliac area, that part is thickened. So you have to have a check whether that thickening is normal thickening because of some chronic inflammation or infection, or it is something that we really need to have a biopsy. So what she can do is she can do a FDG PET, a PET scan, and that scan will say whether the SUV, the pickup of that dye in that particular area, is high. If it is really high, then she has to go for a colonoscopy to take a biopsy from there. But if the pickup is less, small, FDG SUV pickup is small, then it may be some inflammatory process, and she can see a gastroenterologist and have anti-inflammatory treatment for that.
Thank you so much, ma'am. Now we will take 3 more questions. Are all endometriosis cancerous?
No, endometriosis generally does not lead to cancer so easily, or means the risk is very low. But endometriosis is a chronic inflammatory process. It's a chronic agonizing pain causing disease. So surely it has to be controlled in the beginning, because if it is in a big way, then the patient becomes a chronic patient. Continuously she'll have pain and lower pelvic pain, and even during urination she'll have pain. So if there is a sign of endometriosis, please be under close follow-up with a gynecologist to take her or his best expert opinion.
Thank you so much, ma'am. Now we have another question. Does intermittent fasting helps in avoiding cancer?
Actually, it's not like for avoiding cancer. Intermittent fasting, it's like you're cleansing your body. Okay. So surely it will have a benefit on your body. But at least I don't have a study or any case study or any proper study where I've gone through that intermittent fasting has direct relationship with reducing the rate of risk of cancer. But whenever we keep a fast, what are we doing? We are actually giving the intestinal walls a time to rejuvenate and get back to their normal condition. So intermittent fasting is actually very good for the body to rectify the damages that might have occurred because of some junk eating, or even a lot of spicy food eating. So actually it is advisable that all of us should follow some sort of an intermittent fasting. But actually I don't have any study to correlate or refer to that which I've gone through. Maybe there are studies, maybe I've not gone through, which shows that there is direct relationship with reduction in the rate of cancer.
Thank you so much, ma'am. So we have our last question. Is use of air fryer better than grilling?
Yeah, sure. Air fryer actually has nothing to do with carcinogenesis. It's totally safe.
Thank you so much, ma'am.
It's only we don't want to have a non-veg item being cooked for long time under direct fire. See, if you're preparing the same meat or same mutton, same chicken and in a closed container, eat daily, no problem. But in grilling, what is happening? You're keeping the fire, open fire, and on that the meat or chicken or mutton, it's rotating for a long period of time. So whenever something is for a long period of time, you are allowing some sort of a chemical change in the small cells which are in that meat item, in that non-veg item. So if you're allowing a chemical change, then surely these chemical changes will always try to do something bad to our body if it is taken in a chronic way or in a regular way for a long period of time.
Thank you so much, ma'am. We have one last question from a cancer patient. She said that I have undergone head and nose cancer treatment and now I am cancer free. But after 6 months, she has been asked to get her checkup done. She has been told that she is having side effects of radiation and chemotherapy.
So, all the best to you. God bless you. Inshallah, inshallah, you remain without any cancer recurrence. So, generally, radiation, head and neck cancers, best treatment the available are the radiation and some sort of chemotherapy we give to increase the effect of the radiation. She also might have gone through, and the surgery. So, head and neck cancers, when we give radiation actually, radiation is basically it is burning of the tissue. You don't see the fire, but the radiations are strong rays which are going and destroying. It's like burning of the cancer cells. So you cannot tell the radiation that you just go to the cancer. You don't kill any normal cell. You cannot tell it. Okay. So surely these radiations will also go through the normal tissues. Now, normal tissues, when they are getting burnt off, surely they will cause all these problems. So she may be having, if it was the tongue cancer or cheek cancer, she may be having trismus, like she may not be able to open the mouth well, or she may not be able to swallow well because the radiation to the tongue or the mucosa, the inner part of the cheek, they all dry up and she cannot open or flex and use her tongue or mouth so easily like any normal person. So she can, that only might have been found in the MRI or the CT scan that she has done to find out how is the condition now. And how you can improve on that, keep exercising that part of your head and neck. If it is the mouth, keep exercising, okay, keep opening, and also drink lots of water and try to go out for a walk daily. Take lot of oxygen, and when you are outside, when you are walking, please keep on opening your mouth, closing, and open it full, so that you are actually bringing back the circulation in those burnt off areas so that they can grow new cells so that you feel much better.
Thank you so much, ma'am. Thank you for clearing our doubts in such a detailed manner. Thank you for the very interactive and informative session. Thank you for sharing your knowledge and expertise with us. I want to extend my heartfelt gratitude for the excellent presentation you delivered. May Allah reward you for your efforts. Thank you so much, ma'am. With
Pleasure
this,
is mine.
welcome.
Thank you so much for having me. God bless you all.
With this, we come to the last part of our program. To deliver the vote of thanks, I would like to call Mrs. Afroz Sultana, the co-coordinator of IMA LadiesWing Kuwait, Mrs. Afroz Sultana.
Alhamdulillahillazi bi ni'matihi tatimmu salihat. All praise is to Allah subhanahu wa ta'ala, by whose grace good deeds are completed. Respected keynote speaker of today, Dr. Susovana Nair. Opening speaker, Sister Nazia Umar. IMA LadiesWing Central Coordinator, Sister Tabassum Fatima, and all the team members and our lovely audience. Islamic greetings. Assalamu alaikum wa rahmatullahi wa barakatuhu. A grateful and very good evening to all. First and foremost, I thank Almighty Allah for blessing this opportunity to organize such an event, which is the need of an hour. On behalf of IMA LadiesWing Kuwait, I would like to thank IDF President Dr. Diwakar and Community Secretary Dr. Syed Mahmood for facilitating this webinar. I thank for your humble support. I would like to thank our opening speaker, Sister Nazia, for your brief yet fruitful remarks. Special thanks to Dr. Susovana Nair, who gave an amazing presentation on today's topic of cervical and breast cancer. Her response on our call and taking out time for such blessed deed out of her busy schedule is worth applause. Thank you all, lovely ladies, lovely audience, for taking out time for attending today's session and making it successful. The question answer session was dealt so patiently. Thank you so much, Dr. Susovana Nair. Last but not the least, on behalf of IMA Core Team Committee, I would like to thank our social service team as well as our Islah-e Mashara team for your fantastic and professional efforts for organizing such a good webinar. Also, I would like to thank today's conveners, presenters, our Quran reciters and media team for your thankful support and making this whole event well organized. Hope to see you all in our future programs. And I would like to end up my words with this beautiful dua that may Allah keep all of us safe and sound and bless us with healthy life. Jazakumullahu khairan. Assalamu alaikum.
Amen. Thank you. Thank you so much. Stay blessed.
With this, we come to the end of our program. Thank you all for joining us. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Amin. Jazakallahu khair. Assalamu alaikum wa rahmatullahi wa barakatuh.